I'm here for questions, any general questions, any specific questions. I can get your information and have myself or one of my staff work with you on your claim as well. Yes.
So prior to 041 appointment, certain individuals were vaccinated.
Mhm.
I was wondering if those types of vaccines have been added to any list.
So, good question. That is not part of, on a list per se, but any reaction or any disability that you think you have that was a result of those, vaccinations, you can file a claim based on toxic exposure. And again, there's more, development that has to be done, but that is a way we can look at that disability. If you think that your vaccinations have caused something for you, an immune disability or something. So it's definitely something we can, submit a claim for.
Are you speaking about the anthrax one where we had to take the 6 series?
Yeah, they hit us with a bunch of vaccines.
Yeah.
For deployment, for
Yeah.
security
Yeah.
operations.
The important thing to remember is though, you have to have a current disability. Just by virtue of having those vaccinations, maybe, if you gotta believe that what you have something right now that needs to be treated or a disability, and you think that it may have been caused by that. So you have to have something currently going on.
Yeah, there's a latency to this. So.
Yeah, oh, for sure, for sure. Any other questions?
I'm just curious because you talked about Agent Orange. Well, I did TDY trips over to Vietnam, but spent a year and a half in Panama.
Okay.
And they sprayed every week
Mhm.
for a year and a half. I don't know what they sprayed. It was for mosquitoes. Do we know, or is that something we have to look into if that's?
Well, good question. So, I don't recall all of the areas that they've expanded, that the law recognizes. I don't recall them. Thailand is one, and along the Korea, the DMZ, Panama. I don't recall that, but it doesn't mean you shouldn't file a claim. Because we can take into consideration where you were. You can put in that you were exposed to toxins, and this is what, and we will do the research on that. So if it's not on a list, you don't think it's presumptive, file the claim. Let us make that decision for you. You won't. I mean, we can't say yes if you don't ask.
So there's a couple things, as Carrie was mentioning, the way to work your disability rating, if you want to have that either established or expanded potentially, is you have to actually file a claim through the system. You can do that either through the VBA themselves. You can do it yourself online at va.gov. Wouldn't recommend it, but you can. And you can also utilize our veteran service representatives, our VSOs, Trina or Tommy, that are in Southeast. Great resources to help you put the package together. It ultimately will go through the central system for processing, but you have local people that can assist you with that. You can work with Carrie's team up in Anchorage remotely. You can go into their office if you feel like traveling, or if you're in the area, or you can do it, like I said, online. And they have an ability to make an appointment if you want to use their team at 1-800-827-1000. I think.
Yes, I have a QR code that makes it even easier though, that you can schedule a virtual appointment with me or my staff. And so when you make an appointment through our Vera application, you're actually talking to staff in the Anchorage office. It's not another state, it's not the call center, it's my staff in the Anchorage office. And you bring up a good point about you have to file a claim. You're talking to your doctors, your providers, your VA doctor, and you're like, oh, they know all this, but they're not doing anything. They're not going to do anything because as Mr. Steinbrenner said earlier, we have 3 different branches and we don't communicate together that way. So if you tell your doctor one thing and you want to claim that, you gotta come and tell us too with an application. So,
Right, the way Congress put it together is we're an opt-in service, not a automatic, service, unfortunately. That's it.
So separation from service, it was subject to 4 years after separation for recall. And if we were recalled for any purpose. But is that
so
part of service related?
yeah, well, it can be. Anytime you are on active duty, whether you were recalled or you're National Guard, and you're activated, reserves and you're activated, you can file a claim for any injury that happened during that period. So if you were the 4 years you weren't doing anything and then they recalled you, it would be during that recall period. Typically, a period of time that you have a DB 214 or Title 10, Title 32 orders.
NGV 22.
Yeah, so, well, the NGV 22 is, yeah, it shows us all of your guard time, but it doesn't break it down to when you were actually like doing your 2 days a month, 2 weeks a year, or when you were activated or such. So it can be a little more challenging to service connect disabilities for the National Guard and reservists. And Alaska has a large population of that, yes.
So, Carrie, question for the Alaska National Guard, for them to claim they have to be on active duty, called on, National Guard has to be called up for a federal call up, not a state follow up. Is that
They have
correct?
to be on orders. They have to
State
be,
or federal, it
yeah.
doesn't matter.
Yeah, it has to be, we have to show that they were on orders
Okay,
during that, when the injury occurred.
okay, but it can be called up to take care of a flood in the state.
For
Yeah, but-
National Guard,
Yes,
yes, yeah,
okay, good.
yeah,
I just wanted to clarify that.
Yeah.
The other piece, though, is we have the claim portion that Carrie spoke about, but as Dr. Joe mentioned in her comments, toxic exposure screenings is something that the health system does. It's a simple form. She can do it either on the computer or on paper. It's a one-page, essentially, documentation of toxins that you were exposed to. That gets uploaded into your medical record for documentation purposes, and it does a number of things. It takes your information on what you believe you were exposed to and puts it into the system. It allows the VA to have a little bit broader insight into the toxins that service members experienced or were subject to during their military service, so that if the VA is looking at expanding the benefits through congressional legislation, it has a broader set of data and information to pull that information from. The second thing it enables us to help link you to a benefits person to help you with a claim if that's what your desire is, whether it's with the VSO, with the state of Alaska, or with VBA, because we don't do claims processing within the health side. It's sort of the fox and the chicken coop kind of thought process. And so the way Congress established it initially is they established that would be done through our veteran service organizations to help with that assistance. And so there's 3 ways, like I said, the VSOs, the central system with veteran benefits, or through the state of Alaska veteran office. And then the other thing it provides is if you have a specific immediate medical need, it helps alert your healthcare team to assist you with securing those services. So we have in the state, we've processed over 19,000 of these toxic exposure screenings for veterans here in Alaska. And if you have not had an opportunity to complete that, we certainly want to do that before you leave today.
If I can add on the toxic screening, so I call it a success. So with the toxic screening down on the bottom, Carrie, Mr. Steinberg, correct me if I'm wrong, it also asks, do you need assistance on helping on claiming anything else? We had a veteran that did the claim and he put the anything else. He went from 0% to 70%, not because of the toxic screening, like Carrie was saying, you have to have that, but because he needed help on some other things. And so that was that niche to get him in to start doing things. No guarantee, but at least that's a success. So definitely, I encourage you to take the time to fill it out and let's see what happens.
And what it does is this is a vehicle of education, for many of us who were exposed to things, we really didn't know what our injuries or illnesses that the connection were made. I think the PACT Act pulls a lot of information to the forefront that was not necessarily obvious moving forward. I think, similarly, many of our Vietnam brothers and sisters valiantly fought the fight before us because of the exposures to Agent Orange and other chemicals. There's certainly long-term impacts to these exposures, and it allows the VA to then provide services for you. I don't believe the Agent Orange area includes, as Carrie mentioned, Panama, but the exposure or claim process does allow you to indicate for example, on a toxic exposure screening that you were exposed to these pesticides in Panama. You don't need to know what name the pesticide was. They can figure that out. But that you had that exposure, and if you feel you have an issue that you think is attributable to that, then that's when you would then file a claim that says, I have X, and I believe it was due to my exposure to these pesticides during my military service in Panama.
And do you know then, like, I know, excuse me, in Panama, work for Tropic Test Center, but I'm an explosive specialist, so I'm with blowing stuff up every day and destroying stuff the infantry used in war games that didn't go off, tear gas, smoke grenades, and I've been exposed to all of that consistently. And the VA's already said I didn't qualify for hearing aids, even got pretty bad hearing loss. I'm assuming it's because I didn't serve, a tour in Vietnam, but this was before hearing aids, or I mean, not hearing aids, hearing protection.
Right. Sure.
So are you enrolled in the healthcare, in the VA healthcare?
Just recently got to it through Trina's help,
Okay.
because I've been here 50 years and I've tried to go to the VA for years.
Okay.
And nobody ever got back to me for anything, so I just gave up on it.
Okay.
Yeah, so why don't we, when we're done, let's get together with you, and we'll offer the same to anybody else. Each person's situation is different, and we want to make sure that we're taking care of an Alaskan one at a time, as opposed to doing a broad brush and saying, well, this is how it's going to be. It might not fit your circumstance. So let's look at your information, and then we'll see where we can go to get you on the right path to getting what you need.
And then, also keep in mind that, we are a government agency. We're not perfect. So, we're always trying to, strive for improvements. And I think over the last, I've been with the VA for 21 years, and there have been a lot of drastic improvements over that time. So if you've been denied in the past, let's relook at it. There could be laws that have changed that now make you eligible for something that you hadn't considered. So, and if you haven't had a good experience with the VA, and you just feel like giving up, please talk to me, because I am on a one-woman mission to change those experiences into positive experiences. So if you've had a bad experience, you haven't had one with me yet, so give me a chance.
I know there are current chemicals that are being dealt with right now, like PFAS, PFOA, and firefighting foam. So there's something. I was wondering where that is with the VA in terms of.
Good question on that. That has been brought up at a lot of town halls and claims clinics, is the fire retardant, all the, I don't know all the terms for it. In regards to the PACT Act, it hasn't been established like an Agent Orange disability or anything, but it can be rolled into the exposures to toxins. So again, if you think you have a disability, and we see those claims a lot where
they're filing disabilities, related to their exposure to the firemen, the fire retardants. And so there's, development we do, and then, we ask the medical examiner to provide us their opinion on whether they think it's a link or not.
And I think while it's not listed, the AFFF is not listed as one of the particular toxins.
Right.
You know, but neither is diesel. And if you were doused in it, day in and day out, it has health implications, right? And so I think, or jet fuel or whatever, any other, kind of situation, I think the key is, one, documenting that you have the exposure. We do that on the toxic exposure screening. But two, if you have a condition, if you don't have a condition at this point, documenting it on the toxic exposure screening puts it in your health record as, you know, it's already been captured, so that if you can't remember 10 years from now what that was, at least there's that linkage of information, right? So it creates a basis, but it also helps with a broader picture for the VA in terms of if we've had 280,000 veterans and they all have this condition, and the thing that ties them all back to is the AFFF exposure, then it creates a stronger basis for the future determination. But if we don't take the time to do that, there's not a
And there's
ability.
current studies that show the impact of certain organs.
Yeah.
Just.
Yeah,
that are-
it's just helping document that as a veteran, I had this exposure and this is my condition and I fit into that, if you will, that study.
And so similar to the toxic screening, we've had over the last 15, 20 years, we have Gulf War screenings and we had Agent Orange screenings. And again, these are done with your VA providers or through the VHA. And that information is what, you know, like again, like you said, that the provider may identify, oh, you might want to go and consider filing a claim for this. If not, that information is, like he said, is used to potentially expand. They're looking at trends. How many veterans served here and how many have developed this? So it's not necessarily going to help you now, but it's going to help the future generation of veterans. So keep that in mind. If you don't think that it's something positive or worth your while, consider the future generation of veterans as well.
And so for all the services, put a little more perspective for the Navy and the Marines, especially for the Navy. A lot of times we're not physically in theater, but you go into, there's a site talking about the Blue Water Navy where if you're in certain proximities, lat and longs, you're part of that, especially if you're a part of the river rats and things like that. So definitely, as Carrie said, you know, apply. Because you don't hear about it often, but they were part of that, that event.
Right, and it creates, based on your being stationed or assigned, or boots on the ground, I guess is the best way of saying it. You were there. You don't have to prove that, you know, you drank the stuff. You were there, and therefore, if you have one of the disabilities that's connected, they've already made that connection for you. But as we talked about a little bit earlier, you know, we are an opt-in agency for your benefits. So if you were a Vietnam veteran, I'll use that as an example, and let's say you had hypertension, but it was not determined to be service connected before the PACT Act. And now it's a presumptive condition. It doesn't automatically become a service connection for you. You still have to apply for it. It's an opt-in. So you have to go through the motion providing a request for a new claim with the VA. It's the process, but it should work relatively quickly based on the presumptive nature of the claim. Just something to consider. I want to give John just a quick minute to talk about what TriWest does for us, ensuring that we have a viable network here in the state of Alaska, especially here in Southeast, for instances when you can't get your services at one of our VA.
Well, thank you. Yeah, I'm John Lee, and I'm the Vice President for Tri-West Healthcare Alliance. The company's based out of Phoenix, but the Alaska operations, as Director Steinbrenner said, it's all, you know, the VA is contracted with my company specifically for Alaska. It's called Region 5. And so I have a team here in Alaska, all Alaskans who support the VA here in this. And our job is to go out in the community, find providers, network or contract with them to get them into the network, manage their quality, credential them into our system. And when you're referred by the VA out to those providers, your provider will submit the claims to us, and we process those the claims payments for those providers. We're gonna have I think a great Alaska team of all Alaska-based employees, and just happy to be part of it and happy to be here in Alaska providing great care for you all. And if you have any questions, I'm here. I can stay afterwards. If you have any questions or any comments you want to share with me, I'm happy to talk to you afterwards or now. Any questions? Thanks, everybody. Appreciate it.
All right. Before we break up and answer any of your individual questions that you might have, I want to take a quick minute to thank Gloria, amazing veteran in her own right, but also the University of Alaska for allowing us to use the space and capture the information for those who can't be here. Each and every corner, Gloria has been an amazing supporter of this, and so this has been, I think, a very successful way of getting information out in the Southeast area, and we couldn't do it without the great support of the university and you. Thank you. So if you have any questions about your community care referrals or claims, Dr. Loza-Keating or Julie would be happy to answer those for you. If you have a benefits question that you want to talk about filing or the status of your particular claims application, certainly Carrie Epperson, who was up here, Trina over in the corner, or Tommy, who's talking to that nice gentleman, can certainly take your information and make sure that you're connected. If you want to do one of the toxic exposure screenings that I mentioned, please, Dr. Cynthia Joe, our chief of staff, will take care of that. Dr. Loza-Keating can also assist with those to make sure that we get that information recorded. Dr. Joe has her computer, she'll take it right into the system. Dr. Loza-Keating will capture the information and then upload it later this evening to make sure that it's in the system.
Sure. Any changes, forecasts, or any upcoming changes to the Juneau VA clinic? Personnel, hours, staffing, whatever?
Yeah, it's a good question. We do have our new nurse practitioner, Susie Rexton, who has now been with us for, gosh, the better part, almost a year now. And we have a team, Michelle's our social worker, and we have a team of nurses that support. We are looking at bringing on a part-time chiropractor who's expressed interest in the Juneau area. We do have Dr. Benjamin, who provides acupuncture support. One of the things that we have is a bit of a limit in terms of the federal building is the size that we have in the facility, and we have an ongoing long-term project with the General Service Administration, which operates the federal building, to expand our clinic. That has slowed to an absolute crawl. I'd like to say that it's moving quickly, but I would be telling you a bold-faced lie. So we're looking to come up with a different alternative, perhaps a different space within the building that we might be able to make that go a little bit faster. But GSA process is super, super slow. In terms of other capabilities, we have this week we had Dr. Caitlin Milligan, one of our audiologists, on site to support Southeast. And we are expanding our telehealth capability back to specialists in Anchorage, as well as our clinical resource hub that supports our entire Northwest market. And so one of the neat things that we have made available through that is rheumatology and endocrinology are not something that's readily available in the state of Alaska, but we have the availability to provide those services to our veterans through that telehealth modality. that we would otherwise not be able to, physically do in the state because of either, complete lack of, availability or the, 8-month time waits, for appointments. Yes, yes, sir.
Along the same line about the clinic is there any consideration at all to just leaving the federal building for another location outside? Federal building's a terrible place because there's no parking. And if you have any kind of a disability or whatever, trying to get there, especially in the snowy, icy conditions like this, you're taking your life in your own hands if you get there. And then you gotta go through that whole, strip and search deal to go through there. And I know a lot of people that just won't go just because of that.
Yeah, I fully appreciate the strip search, concept. I think at one point we're down to a tissue, because, it's a very sensitive system, just like the TSA process. So I hear what you're saying on that. We have looked at the potential of moving out of the federal building. It's leasing within the federal government requires a couple things. One, it requires a release from the General Service Administration, which is the owner of record through the federal system for all government buildings, and they have to determine whether or not they can meet our requirement before they cut a release to allow the clinic to be moved outside of the facility. So I will tell you, just from us standing here together, it'd be challenging to argue that we couldn't create a clinic in that facility when there's 2 of them inside the federal building. So it's an uphill battle to potentially move out of the federal.
Well, yeah, you could put a clinic anywhere, but is it really gonna be, is it very user-friendly to your clientele?
Sure.
And that's my thing. I mean, you go to Anchorage, yeah, you just pull right into the old parking lot, walk right through and right into the building and go see whoever it is you want to go see.
Right.
Not quite so easy here in Juneau. You got
Right
a
across
car
the
a
street.
block or 2 or 3 away and walk along all that thing and get through it. Then you're greeted with having to go through the whole metal detector thing and strip down for that before you can even get in there. And
Sure.
like I say, a lot of people, yeah, it may meet the requirements. But if you lose half your clientele because they don't want to mess with that, then it's kind of counterproductive.
No, absolutely. I hear what you're saying. That's something that we can certainly explore. I can tell you that when they did a site survey, gosh, we've been at it with GSA for coming on 5 years to expand the clinic inside that building. When they did the initial market survey, finding a space within the borough that was in a central area for veterans to go to, was really hard to come up with at the time.
Right across the street, where the permanent fund's at, 3-story building, 2 floors are empty. And they have parking. They're trying to lease that space or sell the building right now.
Sure.
They have some parking.
You could
Yeah.
convert any space
Not
into a
much.
clinic. I mean, that clinic was a bank before it was a clinic. So, I mean, it wasn't even, it had
Sure.
nothing to do with medical stuff.
No, I appreciate that. Appreciate the feedback.
So lastly, just real quick, I took some pictures. Does anybody have a problem with me putting some of the pictures in the school, putting some of the pictures on their site? Yes, Maureen. Always one in the cloud. Does anybody have a problem? Okay, I don't see anyone. All right, thank you. Everybody except that Charlie back there.
So again, if you want to us to look at any of your specific issues, we'll stay here until the last person is done. But want to certainly thank you for coming out tonight. We exist because we're here to serve you, and if we're not meeting your needs, we take that seriously. Most of our team are veterans themselves or direct connections to veterans. And so we like to think that we operate a system that is something that we would want to use ourselves, not because we have an inside track to the system, but because we're veterans, just like you are. So, thanks.
Our VSOs are awesome, so. Been a great experience.
Okay. All right, well, thank you.